Okay, so this is fascinating. I kind of stumbled on this the other day, and I wanted to kind of connect the dots for you. I started looking at all these things, and there's like a common denominator: excess calcium. Now, when I say excess calcium, I'm talking about calcium that's locked up in the body. It's not necessarily just because you have too much calcium. Let's just say it's unavailable calcium. It's like plugging everything up because it's unavailable. It's not ionized. It's not broken down, and there's too much of it. So it's called hypercalcemia in the blood, and the calcium is going inside the cell. Inside the cell and outside the cell, you have 10,000 times the concentration of calcium outside the cell. So when that calcium starts going inside the cell, intracellular calcium, that's what I'm also talking about, that too. Okay, so when I talk about excess calcium, I'm talking about calcium in the wrong place of your body. All right, we're not talking about excess calcium in the bone. All right, so look, check this out. This is incredible. Let's just kind of go through what calcium can do. Hey, that rhymed. Okay, so let's just start right up here, angina. Chest pain. Calcium stimulates the sympathetic nervous system. That causes contraction of the smooth muscle, the cardiac muscle, and the nerve muscle. The nerve, not the nerve muscle, but the neurology. So too much calcium can cause a cramp of the heart and cause angina, chest pain, and even a heart attack, because the heart is contracting too much and it's not relaxing because they don't have enough magnesium. Okay? Now, arrhythmias, too much calcium. But just so you know, low calcium could also cause arrhythmias too, but more likely it's excess calcium because it affects the electrical conductivity of the heart. So you have atrial fib is too much calcium. And the heart rate is too high, too much calcium. You could even have a stroke because excess calcium will stimulate too much fibrin, and that goes in there and starts plugging stuff up. Because remember, calcium is kind of like the cement that patches stuff up in the body. And if there's damage in the arteries, for example, it goes in there, causes plaquing and atherosclerotic plaquing, and it plugs up the arteries. So it's trying to help you, but it's basically plugging everything up. And then this alone will cause a heart attack. All right? High blood pressure. Why? Because the arteries are not elastic anymore, and you're going to get, like an adrenal problem would be, excess cortisol will cause high systolic blood pressure first. So the excess calcium. Okay? Now, fibroids. I did a whole video on this, and I talked about calcium deficiency. What I should have done is clarified it means unavailable calcium because it's locked up in the cells, and it's unavailable, so it would be deficient. But calcium controls the communication of cells, and if that calcium loses control, then the cells proliferate and they start duplicating and start growing, and you start getting tumors and fibroids and polyps and pimples and cancer, and from the loss of control of calcium. Okay, calcium stimulates the sympathetic nervous system, and therefore it messes up the parasympathetic. So you're going to have a bladder valve problem because of the autonomic nervous system. Now you can't relax and contract that bladder muscle, so you're going to have fluid retention, yet it's not going to come out. All the valves are controlled with the autonomic nervous system, so if calcium is too much, it's going to create an imbalance with your autonomic nervous system, and you're going to pee way too much at night, and you're going to have a valve problem. And then we got cramps. One cause of cramps is too much calcium. We talked about that in another video. And then you're going to get something called soft tissue calcification. And soft tissue calcification, that's in the arteries is plaque, the joints is spurring and grinding and popping and clicking and stiffness, and all the itises like bursitis, tendonitis, arthritis, all the itises, because there's calcium deposits that are going all over the place. Stenosis, that's the canal on the spinal column, is getting smaller because there's a buildup of calcium around the canal. and then tetany, which is twitching underneath the left eyelid. Cataracts, that's calcium in the eyes. Joint clicking, all excessive calcium. Itching and hives is excess calcium. Constipation is excess calcium. Why? Because what's the common remedy? People use magnesium for constipation because it lowers the calcium and relaxes the colon. You can be very fatigued if you have excess calcium. Decreased reflexes, weak. So we have the smooth muscle. You lose tone with too much calcium. And that's another thing with the colon. It's all smooth muscle, so that actually just kind of gets all flabby and congested. It's because of excess calcium. So you get a hypo-smooth muscle contraction. And what's smooth muscle? You have the bronchial tubes, you have the arteries and the heart, you have the colon. All that is affected. And then we have insomnia with too much calcium, so your head can't go to sleep, but your body's tired. Anxiety, depression, 30% of the time is from hypercalcemia. So that's how we want to give the person more magnesium for that. Bronchial constriction, boom, excess calcium. Asthma. Why? Because calcium, when it ionizes and it goes into the tissues, it helps the mucous membranes. It protects you against a lot of different things. But if it's clogging everything up, you'll get asthma and you'll get the chronic cough at night. So you get this chronic cough, and then mucous membranes are all swollen of the colon, of the sinus, and the lung. So we get a lot of mucous membranes problem in the colon. And viruses come out of remission when you get excess calcium too. Canker sore. Yeah, that's excess calcium. So here's some facts. The calcium stimulates sympathetics, causes contraction of smooth muscle. Calcium channel blockers are used for the heart, for high blood pressure. Why don't they just get to the root of it? They never do that. Magnesium is the natural calcium channel blocker because it opposes calcium. High sympathetic dominant causes low parasympathetic. All right, let's talk about the causes. I'm not just saying stop consuming calcium unless it's calcium carbonate and the person's taking a lot of calcium. But many times the root cause of excess calcium is a lack of fat-soluble vitamins because people are avoiding fat. They think it's bad. But fat-soluble vitamins are needed to transport the calcium. Like vitamin F is all the essential fatty acids in fish oil. And these essential fatty acids are converted to an available type of essential fatty acid. It's called conjugated linolenic acid, CLA, with some microbes in your gut. So there could be a digestive problem that's now allowing you to utilize this fat. So low vitamin F, that's essential fatty acids in fish oils. Low vitamin K2, we did a video on that. Even low vitamin D can cause that. But I want to explain this because high vitamin D will cause hypercalcemia as well. So let me kind of clarify what I mean by that. If the person has low vitamin D, the parathyroid gland will overreact. It'll overreact, the parathyroid gland will overreact and spike the vitamin D storage in that gland. And then that's what causes the hypercalcium state. So there's a whole chain of reactions. So with this situation, you can have too much or too little vitamin D depending on what's going on. The other thing too is that let's say you don't have enough bile in your gallbladder, you're not going to absorb any of these fats. So it doesn't even matter. So you want to kind of keep going deeper and deeper and deeper till you find the root problem. But I put a lot of people on omega-3 fatty acids of fish oils, K2, vitamin D, for excess calcium. And it's a great remedy for all these things right here. Okay, now we also have cortisol. Stress can cause this as well because it makes the body alkaline. Calcium can't travel in an alkaline body. Okay, so we have to acidify, and that's why apple cider vinegar ionizes calcium for cramps, and it gets rid of cramps because it mobilizes calcium, and it's good for a lot of different things. All right. Low hydrochloric acid in the stomach could also be the source of excess calcium. And so that's kind of a summary of what's going on. But the heart is really, really, it really needs a lot of this fat because it runs on oxidized fatty acids, not on glucose. It runs on fat. All right, so I hope this helped. And it might be a little complex, so you might have to watch this multiple times.